Let's get some more. We can speak now to Sonia Joly, who is the head of the Libya programme at the Danish Refugee Council, who joins us now from Tunis. Thank you very much indeed for joining us. We've got this shocking new death toll from the Libyan Red Crescent. They're saying 11,300 people likely to have been killed in the flooding there in Derna. I mean, do you think it could be actually even higher than that?
It will indeed be higher than that. Like the report we get is that the sea is bringing back bodies actually every hour. Currently, the city of Derna is not accessible to citizens. They have evacuated and they're only doing dead body management. So I think the estimates we have will likely raise in the next days, unfortunately.
And just tell us, I mean, the Danish Refugee Council is actually on the ground there in Libya. What sort of activities are you mostly involved in?
So the first type of activity we do is protection, and our team will look at doing in the next days is psychosocial first aid and psychosocial support for the people, for the survivors and the affected population. We are also doing explosive ordnance disposal and then the risk education linked to that, and we're essentially extremely afraid of contamination of the soil at the moment due to the flood. It's one of the highest risks. With the movement of the contamination, Libya was really affected, during the last years of conflict. So there's possibilities actually for humanitarian workers and the displaced population to be affected by that, and to increase the current death toll for the affected. We also are going to start doing shelter activities and then supporting with non-food items such as hygiene kits, dignity kits, and we are also thinking about a bit of the midterm future, which is in 2 months, winter is coming, and then people with the number of displaced, we have 35,000 at the moment. It means that they will need actually proper place to stay and then to be ready for winter.
Okay, so what you were saying is that there's a risk now of disease breaking out in these areas because of the numbers of bodies and just the general level of chaos and in the area that's worst affected, namely the city of Derna. I mean, that could prove to be extremely deadly, couldn't it?
I think indeed, like with the current situation, we can have a lot of risk in terms of this is spreading, but not only. Like you have vulnerability that are acute. People were already affected. You had already displaced people, for example, in Benghazi. So we are looking at really just high risk in the next month, and it's why it's key to act now and to be able to deliver assistance as fast as possible to ensure that we make sure that this death toll doesn't continue to rise in the next weeks.
And of course, you need to coordinate, don't you, with other agencies, other NGOs, to make sure you're not duplicating and doing the same work in the same place. That must be extremely complicated. How does that work?
There's different coordination mechanisms. The first one is led by OCHA and the UN agencies, making sure that we are all together working on the ground. We have also an INGO coordination mechanism, making sure all the NGOs are working together, and we are coordinating also with the local authorities on a daily basis that are coordinating actually directly on the ground with the Libyan Red Crescent, the coordination effort around Derna.
And if someone watching wants to help, what can they do from their home?
I think, first of all, share what's happening, because it took quite some time to put this on the map, and the situation is not likely to improve. And donate to relevant organizations that are working on the ground.
Okay, what would be apart from yourselves, or would someone donate directly to the Danish Refugee Council? Is that how it works on your website, perhaps?
Exactly. Yes, we have a donate button on the website. So this is the best way, as we are now doing, like a response up to 2 million, and then we're looking at funding this response to make sure we can be there for the next at least 6 months to support, and then probably do more, because it's going to take years, maybe decades, actually, just to support the people in the eastern region. That's one thing. And then the other is to make sure that we continue like strengthening what's happening, because, you know, like we used to have a development context almost, and then now it's key that the actors that are there on the ground are able to do like the big, let's say, humanitarian work that has to happen in the next week.
Okay, well, thank you so much for taking the time to talk to us. Sonia Joly, head of the Libya programme at the Danish Refugee Council. Thank you so much for your time.
Thank you.